Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for British Columbia for Monday, November the 30th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, we'll be providing a written briefing about information relevant to COVID-19 in British Columbia. On Wednesday, we'll be back here in Victoria to give a briefing on COVID-19 in person. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. Today, of course, being Monday, we're reporting on the three periods from Friday to Saturday, Saturday to Sunday, and then Sunday to today. Between Friday and Saturday, we had an additional 750 cases of COVID-19 reported. On Saturday to Sunday, 731 cases. And from Sunday to today, 596 new cases in BC. Additionally, as you know, we had some challenges with lab reporting and reconciliation of the data last week in Fraser Health, and we have cleaned that up over the weekend thanks to the hard work of the epidemiologists. So there are an additional 277 historical cases that were added to the database between November 18th and 26th. So that brings us up to a total of 2,364 cases over the past weekend, 10 of whom are epidemiologically linked, for our total of 33,238 people diagnosed with COVID-19 in British Columbia. That includes 371 people from the Vancouver Coastal Health region, 1,365 new cases, plus the additional 277 historical cases from the Fraser Health region, 58 people in the Vancouver Island Health region, 212 people in Interior Health region, 73 people additionally in the Northern Health region, and one new case in a person who resides outside of Canada. We now have 8,855 active cases in the province, of whom 316 are in hospital, 75 of whom are in critical care or ICU. We have 10,139 people right now under active public health monitoring and 23,111 who have recovered. This weekend, we had an additional 46 people who died from COVID-19 in British Columbia, which is the highest number we have ever had. 441 total in British Columbia. And my heartfelt condolences go out to the families of each of these people. Each of these husbands, wives, sons, daughters, grandparents, all of whom lost a loved one this weekend. We all feel your loss, and we mourn with you. And I want to, as well, express the pain that I know that the caregivers in the communities that these people lived in also are mourning their loss this weekend. Most of the people, about 80% of these people, were people who lived in long-term care. And it reflects right now the challenges that we have in dealing with this virus in our communities, and the fact that it can cause such devastation when it gets into our care homes, and the impact it has on seniors and elders who are so important to our history, our family, and our community. We also have 5 new healthcare outbreaks in Mountain View Village, Fleetwood Villa, Lakeview Care Centre, St. Jude's Anglican Home, and Veterans Memorial Lodge at Broadmead here on Vancouver Island. 2 outbreaks were declared over at the Kiwanis Care Centre and Louis Breyer Home. We now have 57 active outbreaks in long-term care and assisted living, and 5 in acute care units here in the province. And right now we have 1,338 active cases in long-term care, 847 residents and 487 staff. There, in addition, has been one new community outbreak at the Newton Elementary School in the Fraser Health region, which has been closed for the next 2 weeks, where students and staff are self-isolating. I do want to take a moment to really recognize the incredible work of our teams in each of the long-term care homes and healthcare settings. Healthcare workers have been at the front lines, or maybe the last line of defense right now, but have been working so hard in our long-term care homes, and I know how challenging it is, and I'm with you every single day, supporting you and in admiration of the work that you're doing. It's also very easy for us to focus, as we have been from the very beginning, on our daily numbers. And I just want to talk about that a little bit, because as we've recognized over the past week, there can be challenges sometimes in what those numbers actually mean. They have become an important measure both here and across the country. And I know many people look to the daily statement and the update on the BC CDC dashboard. The process to compile this information, however, is still arduous, and it takes the work of many epidemiologists across the province every morning to figure out exactly who's new in every single day. The challenge is that these are living, ongoing databases, and a daily number is really a snapshot in time. And as our cases have increased quite dramatically over the last few weeks, the processes that we've used to do that have been challenging. As we know, sometimes there are issues, and we have corrections that need to be made. And today, for example, we did a revision and added the additional cases that had not made it into the daily list, even though each of those cases had been notified and that public health was following up on them. I do want to again thank all of the team at the BC CDC and our health authorities for the work that they do every day, and again the work that we did through this past weekend to reconcile the numbers that we have and make sure that we are reporting everything in the statistics. In the coming days, however, we will be switching our systems to further automate some of the functions to make it easier, so that we're not spending our time focusing on addition and adding the numbers and being able to reconcile databases and able to use the work of the epidemiologists to understand more fully the contacts and the cases and the outbreaks and clusters in the community. So these daily numbers are important, and we recognize that, but it is a snapshot, and what we need to track is the trends. Are we going up? Are we going down? Are we leveling off? And we will be adding in a more fulsome way, the measure of the rolling daily average over a given week, or what we call the 7-day rolling average. And that is on the BC CDC dashboard, but we will be talking more about it in the coming weeks as we automate these processes, so that you have a better understanding of how we look at the trends over time. And of course, what we want to see is the curve trending down. So this has been, I don't need to say, a challenging pandemic for all of us, particularly as we're heading into the middle of this second wave. So many of the usual ways that we make those important connections with our families, friends, our communities have been paused or significantly changed because of COVID-19. Many occasions and daily life activities we would normally do together, we must now do apart. Despite how difficult it is, and we know how challenging it has been in these last few weeks, I am heartened immensely that most people in BC are doing the right thing. And I am grateful for that. And I thank you. And especially I want to reach out and thank the faith leaders who are supporting their congregations safely in these most challenging of times. People are following these orders and using our layers of protection for two important reasons. It's our responsibility we have to each other and to our fellow citizens, and it's how we show we care. That is how we are going to make it through this pandemic. We know that COVID-19 is a serious, life-threatening illness with severe consequences for many, young and old. This past weekend, as you know, we had the largest number of people die from COVID-19 in our province. These people have faces, have names, have stories, have families. And while it is the families of those who died we are feeling the most right now, this tragedy is all of our tragedy, and we all mourn their loss. If you are thinking that it may be okay to bend the rules, please remember that this virus takes lives. And it is the lives of those who are closest to us that are most at risk when we take risks. I was also contacted by many faith leaders and others this weekend to talk about some of the issues that we are dealing with, and was reminded in many ways that faith is not a building, that it's not about Sunday mornings, but it's about every day and how we connect with each other and how we support each other. It's not about rights, but it's about community and responsibility to our fellow citizens. And I think we are seeing that around the world with global faith leaders showing an example across the world. And as I was told many times this weekend, that we have many seniors and many elders who are precious to us in our communities, and we want and need to protect them. We are facing a significant storm surge, and this is why right now we need to come together again. We know there is vaccine on the horizon, and that is our goal. That is what will help us get through the next phase. As Pope Francis reminded us this weekend, looking to the common good is much more than the sum of what is good for individuals. It means having a regard for all citizens and seeking to respond effectively to the needs of those least fortunate. We need to push back on COVID-19, united and together. If you are in doubt, remember you are not alone in your sacrifice. Most people in BC are doing it with you. We know most people are wearing masks. Most people are sticking to their households. Most people recognize, they understand the importance of stopping this virus and stopping transmission in our communities. It is our collective effort that makes the difference and will see us through this storm. We have done this before, and we can do it again. And I ask you, please, do your part today to show community, to slow our transmission, to slow COVID-19 without exception. Your actions protect everyone, those you love and those you don't know. We will get through this, and we will do it by being kind to each other, by being calm and being safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to add on behalf of the Premier, I think of everyone in the province, to express my condolences to the families, the friends, the caregivers of the 46 people who passed away over 3 days, the last 3 days in British Columbia from COVID-19, 15 from Friday to Saturday, 17 I should say, from Saturday to Sunday, 14 from Sunday to Monday, 35 of them in the Fraser Health Authority, 11 in the Vancouver Coastal Health Authority. As Dr. Henry said, this is a difficult and gutting time under these circumstances, and our hearts go out to everyone. We are thinking of you. We grieve with you today. I wanted to note that we have 316 people in hospital today, 8,815 active cases, 10,139 people under public health surveillance, that our emergency rooms in our hospitals continue to perform exceptionally well under the circumstances. As you know, when base and surge beds are taken into account, our overall hospital capacity today is 69.7% of beds full. Our ICU capacity is 52.8%. of base ICU beds and surge ICU beds. And in fact, our total capacity is only 74.3% of base ICU beds. And so we are able, in terms of beds, to deal with it. But as all of you will be aware, when COVID-19 is this present, as it is in some parts of our healthcare system, I think in particular places such as Burnaby, places such as Lionsgate Hospital, Burnaby Hospital, and Lionsgate Hospital, it is an extraordinary challenge for our staff, and it reminds us why we have to, when in doubt, rule things out. I've heard some people say that they had some concern or misunderstanding about the new orders, that events that may have been okay before the orders could go ahead because they were okay before the orders put forward by Dr. Henry the week before last. That is not the case. It is time, I think, when there's any doubts, to rule events out, to stop as much as possible the transmission of COVID-19, and to do so because it impacts directly the lives of people we love, of people around the community, people we don't know. And so I encourage people to take those steps right now, especially through December 7th, 1 week from today, when those new orders will be reviewed, that people dig in right now. And I have a lot of confidence in the willingness of people to do so. I spent, as Dr. Henry did, quite a bit of time last week speaking to faith leaders of all faiths and and many denominations of particular faiths. And I was impressed. There's always focus on some people who have concerns with the rules, who want to go outside the rules, but the overwhelming effort by people to be part of the healing in BC, to be part of the support for one another in BC, and to not proceed with traditional worship services that are beloved, after all, is something that's very encouraging. And I have to say, in my weekend, my observation is that people in BC were extraordinary this weekend, and I can only express my appreciation to all of you for that. I wanted to bring updates to issues that we regularly do on Monday, just to note with respect to our influenza vaccine measures that, as you'll be aware, we've ordered 2,241,600 doses of vaccine this year. That's a 47% increase over last year's available doses, which was 1.5 million. As of November 26, 2,041,540 doses of flu vaccine have been sent out to regional health authorities. And as of November 26, we know that at least 1,206,006 doses of influenza vaccine have been administered to British Columbians. We also know that the number of doses administered is higher than the $1.2 million figure, as there is a reporting lag of up to 30 days from pharmacists and physicians and community providers such as nurse practitioners. Most importantly in that, and I wish to express my appreciation to the pharmacy community around BC, I would note that last year, as of November 26, pharmacists had distributed 606,858 doses of influenza vaccine, and as of this year on November 26th, that number was 896,935. In addition, 200,000 plus doses under the medical services plan from physicians, nurse practitioners, and registered nurses, and 100,000 plus doses of influenza administered by public health. So we are in the hundreds of thousands ahead of last year in terms of the doses distributed. And when you consider for public health that this has taken place during a period of COVID-19, I am very, very appreciative of that effort. On Monday, we also provide an update of PPE received over the past week. As you'll be aware, over the last since March, we've the following PPE has arrived in BC and been approved: 7.7 million N95 or equivalent respirators, almost 130,700,000 surgical or procedure masks, 2.9 million pieces of eye protection, including goggles and face shields, almost 235,400,000 pairs of gloves, and just over 15 million gowns. In the last week, the number of the PPE that's arrived in BC since November 23rd is 30,586 N95 or equivalent respirators, 1,863,000 surgical or procedure masks, 8,782 pieces of eye protection, 21,448,000 pairs of gloves, and 1,963,000 gowns. As noted, and as I noted last week, there was a significant arrival at YVR earlier in the month. All of this material, as we go through a process, is being processed into inventory and tested now. That includes 43.2 million pairs of gloves, 24 million procedure masks, and 105,000 gowns. And finally, I wanted to note, I think, that what all of us know is that COVID-19 is not a passive foe. It doesn't argue. It doesn't demand. It seeks to find. It seeks to transmit from one person to another. That's what it does. It does it in our workplaces. It does it in our homes. It does it in our communities. It is relentless. And especially in the winter months, and we have seen this, when the nature and location of our contact with each other change, it is significantly greater, the transmission of COVID-19 right now, than it has ever been. We must not be distracted from our focus. We've got to make sure we're consistent in taking the actions we need to take to stop the spread and save lives. We must not let up. We must not let down. We must push back and push back hard on this COVID-19 resurgence. We know what to do, and we know how to do it. Now, like no other time in our BC pandemic, we must go all in to bend the curve, not the rules. We must be 100% committed to sealing the cracks and closing the gaps to give access to COVID-19. And after this weekend, after this report, I think all of us need to reflect and redouble our efforts. I know that in the healthcare system, people are 100% all in this effort, and we are, of course, acknowledge that considerable effort everybody is making, which is extraordinary. But we need everyone to be part of it. When in doubt, just rule it out. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune. Pour la première période de référence qui s'étend jusqu'au 28 novembre, nous avons eu 750 nouveaux cas. Pour la deuxième période de référence qui s'étend jusqu'au 29 novembre, nous avons eu 731 nouveaux cas. Au cours des dernières 24 heures, 596 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 316 personnes sont actuellement hospitalisées, dont 75 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up only. I would also ask that you please unmute your phones. You will not be audible until your name is called. First question today is from Von Palmer, Vancouver Sun.
Good day, Minister. Good day, Dr. Henry. I wanted to ask both of you about your reaction to that staff memo that was distributed at the Blanchard building, the Ministry of Health building last week, where staff in the building were advised there had been a case in the building. Only some people on one floor were informed. Other staff in the building weren't informed until well after the fact. Are you aware of how this was handled, and do you approve of the way it was handled?
Absolutely. I work in that building and have been one of the few people who was there often by myself for the last few months. So yes, I was aware of what happened. There's a plan, a COVID safety plan in the building at 1515 Blanchard that was being followed, and public health was notified right away. When the results came back, the person responded with their supervisor and the protocols were followed. So I think it was done well.
Have a follow-up on?
Yeah, I see the GEU union saying they think there needs to be better communication. I see the memo from the health ministry says there needs to be better communication. So what sort of communication should be taking place? Because there seems to be a concern that there wasn't enough communication in this case.
Well, I think it was a wake-up call for many people, perhaps. There's a sense in parts of the province that we are maybe not going to be exposed to this virus. But it reminds us that it does travel. It travels with people. And we now are seeing cases here on Vancouver Island when there was a sense of complacency. So we've seen this many times around the province in different workplaces where people feel particularly vulnerable and anxious when there's a case that's close to them. This is not unexpected. We have over 1,000 people that work in that building. Most have been working remotely, and there are safety protocols in place. So I think it was handled very well, and we, of course, hope that the person is recovering well.
Keith Baldry, Global News.
Oh, hi, Dr. Henry. Minister Dix. The BC Centre for Disease Control situation reports every Friday in November seem to be decidedly bleaker every Friday than the previous Friday. Was this steep trajectory in these types of numbers anticipated or feared? And is there anything you can point to which suggests this trajectory won't continue the same steep ascent into December?
Yeah, so what we can point to is, what we are seeing in our 7-day rolling average. We know where the issues are, and we know that's reflected in the numbers and the analysis that we put out in the Friday bulletin. So it is a stark reminder to us that we have to take the measures that we have put in place to protect all of us, because this virus is in our community around the province. And I know I've heard issues around people traveling, whether it's for work or also recreational travel, and bringing the virus back with them. Things that we should not be doing right now. We know that it is associated with gatherings, even small gatherings, where people are coming together and thinking it's okay, but it spreads to those who are in your family, in your household. And that is what we need to pay attention to right now, and the bulletin on Friday is a reminder of that. We have seen a leveling off over the weekend, but we have to make sure that we are all doing what we need to do. And I also think we need to be really positive. People are taking this to heart in British Columbia, and most people are taking the actions we need. And for that, I think I just want to express my gratitude, because people are doing the right thing. And that is what is going to get us through this.
Keith, do you have a follow-up?
No, thank you. Thanks.
Oh, thank you. Next question is from Lisa Cordesco, CHLY.
Thank you for taking my question. Minister Dix, you often mention your single-site policy at long-term care homes, but those workers are allowed to have other jobs, and some have taken jobs in fast food restaurants and to home care workers. And given the, almost daily outbreaks at long-term care homes, are you considering eliminating, those exceptions that are made to allow for second jobs?
Well, I'll start, and then because it is actually my order. But we have to recognize that people's circumstances are challenging, and we made some changes to make it easier for people to have a full-time job as a care aide in a care home. But there are people who have needs that aren't met by that, and yes, we can't prevent people from having the means to live and the needs that they have in their family. But we do pay a lot of attention to all of us in healthcare, making sure we're monitoring our health every day before we go into work, making sure that we are not going and participating in risky activities. And these are the things that we need to pay attention to more than ever right now. So yes, we can sometimes have other jobs that are necessary for us, but that means we have to make sure that we're adhering to our safety protocols in every aspect of our life.
Just say, I think what made the single site order unique in British Columbia was the decision that we made to provide real support to really implement the order. And that meant raising up the salary levels of people who were paid below HEABC levels, and that was the annualized cost of that is $165.4 million. And that tells you a little bit about how much less than the negotiated level that many people in long-term care were being paid prior to the pandemic. That had improved. In the previous years, the gap was still very high. So the seriousness with which we take the order that was put in place for long-term care, the single site for long-term care, the seriousness of that order is reflected in the very significant investment and the sheer number of people. I think it was 8,800 who directly moved, including all the other people who benefited from the salary decision around the order. So we take the single site order very seriously in long-term care. But what it reminds us of is that all of these measures are necessary. And what are all the measures? Well, they're all of the infection prevention measures that Dr. Henry just referred to and that are there. The need for significant staffing and improved and new staffing in long-term care. And we've seen, I believe, in the last couple of months, more than 1,000 people hired in long-term care. The single site order is critically important as well. The incorporation of long-term care into our PPE supply chain is very important. The final component of it is we all have to understand, I think, there are 50 to 60,000 people who work in long-term care, more than 100,000 people who work in healthcare. And when COVID-19 is as present in the community as is now, it's going to touch people who work in healthcare. And that reminds us of the critical link between all of our behavior, that we're all in this, that we're all part of the effort to protect long-term care, every single person in BC, and that a critical part of it, in addition to all the actions we're taking, is for us to reduce transmission. But you know, BC's record on this has been good compared to other jurisdictions, but the losses have been, to my way of thinking, enormous. I feel them today, and we feel them every day. I know every care aide and nurse and doctor and support worker who works in long-term care feels them, and that's why the single site order is so important.
Lisa, do you have a follow-up?
Yes, thank you. Given the fact, though, that many home care workers visit private residences every day, and some then go on to work at long-term care homes, will you reconsider the call that, you know, many have made that masks be required by clients and families and visitors in private residences where home care workers attend, because they feel their bubble is just very large because of that?
Yeah, so there are processes in place for making sure that visits in home care can happen safely. So there are long-standing infection control processes, things like minimizing the number of people that are in the room and only those necessary when you go in to see the client, making sure that you're using appropriate PPE, that if somebody is in the room, they maintain their safe distance, wearing a non-medical mask if they need to, but they should not be in a room full of people when they're going to provide home care, and there's ways that you can minimize it. And I think there are good protocols in place to support people in home care.
Next question is from David Molko, CTV.
Dr. Henry, last week you touched on some of the challenges of this wave, including that you were surprised by how soon we started to see the surge. Maybe another way of putting that perhaps would be being caught off guard. We've seen more health orders, more enforcement, but also record daily cases, record hospitalizations, and record deaths. So my question for you today, and it's more of a bigger picture question, in your view, how are we still trying to catch up, and what do you not have or not have enough of that you really need right now?
Yeah, that's a challenging question, and I don't think I said I was surprised. I think, well, I did say I was surprised. I was surprised by how early it started. So it was late August, early September when we started to see the fall rise in cases. I wasn't talking necessarily about the steeper rise we had in October. I was absolutely expecting that as we went into respiratory season, it was very likely that we would start to see increased cases. So what I probably, well, you know, it's so hard to predict. If we look at the models that we were talking about in the spring for what could happen in the fall, they did start in September. So it all is, you know, we learn as we go with this virus. Right now, what I would like to have is a whole lot more experienced contact tracers to be able to help catch up on some of the areas that we found challenging. And you know, that's something that we did plan for, but we now recognize that we needed more than what we had planned for. These things are all things that we learn as we go. But I think the most important important thing that I want right now, that we need more of, is people working together, understanding that we're in this together, that it is the road that we all have to go through, and that we can each make a difference in our own family, in our own neighborhood, in our own community, and that makes a difference for all of us. We do have light. We do have a way out of this pandemic. And we need now, more than ever, to focus on reducing our risk of transmission right now so that we can get to that point where vaccines will have come in, where the weather will change again and it will be less permissive or less transmissible, and we'll be able to start some of those activities again that we so dearly need and hold in our lives.
Do you have a follow-up, David?
Yeah, a question from my colleague Shannon Patterson on restaurants. So you've asked people not to socialize. That includes dining out with anyone who doesn't live in their household. You've touched on this in the past, maybe a month or so ago, but are you expecting restaurants to enforce this? If 6 people show up, should they ask? Should they verify? Is the onus on the restaurant? If that's not practical, what do you envision?
I think the onus is on all of us to do the right thing. And that goes to a number of different things. We've heard that people are giving people in restaurants a hard time again about wearing masks, about not table hopping, about staying to 6 people. These are all things that are important to protect the people who work in that environment as well as us as individuals. So the onus really is on us. Go out with your family, go to a local place, but follow the rules. And that protects us all and keeps us all safe and allows the restaurants to provide meals for those of us who don't have time to cook this COVID times. But, you know, this is a really important thing. We see the same thing with the mask mandate. If you are somebody who does not believe in masks, then don't go to those stores, because don't put other people at risk. And go at a different time, shop online, find other ways to do what you need to do. And for people who truly cannot wear a mask, find ways that we need to find ways to accommodate people, but we can do that without taking it out on the people who are working in those environments, because this is about keeping them safe and keeping all of us safe.
Rob Monroe, Info News.
Thank you, Dr. Henry, for taking my question here. Senior Advocate Isabel McKenzie and the Care Providers Association have both said that there's no known cases of COVID going into long-term care homes through visitors. And I'm wondering if that's still true. And they're also concerned that there's not real clear guidelines requiring these care homes to open up the visiting, the one designated person, so they can get more time and help out more feeding their loved ones and not leaving them alone to die. So I wonder if you can respond to that.
Yeah, so this is a challenging question, because which came first? We've restricted visitors in long-term care, as you know, because of the devastation, and we only have to look at this weekend to know that what happens when the virus gets in. And yes, we have not had introductions that we're aware of. Sometimes it's hard to tell whether it's from a resident or whether it's a staff person. But you know, with the visitations that we've had, we've done under specific protocols to prevent that. So we are not going back to the type of visitation that we had when we know that there was an increased risk when you had people who were coming in and out of the care home on a routine basis. So the fact that we have restricted visitation means that that makes it a much less likely way the virus can be introduced into a care home. And we have to recognize that the people who work in care homes are there for every resident in that home and are providing care every day to residents in that home. And we can't, we know that when we have transmission in the community, the probability that somebody at one point may inadvertently bring it into a care home goes up. And that is why we have all of those measures in place to try and detect that early, to make sure that people aren't coming in ill, to make sure that we're not transmitting it between healthcare workers inadvertently as well. So it is an incredibly challenging time, and we're not alone in that. We're seeing this across the country, we're seeing this across the world, that communal settings like this, where we need workers to care for people are risky settings right now. And so we have to continue to do our best to keep those as safe as possible. And yes, there is an ongoing effort to try and systematize the essential workers and make sure, our essential visits, and make sure that family are able to safely be with their loved one. But it is very challenging right now with the amount of COVID that we're seeing circulating in our community. And we only have to look at what's happening in care homes, not just in the Lower Mainland, but here on the island, in the interior, in the north as well. So it's a very challenging time, and people are doing their best.
Do you have a follow-up, Rob?
Well, just on that, because their concern is the visitors that are going in, whether they're essential or designated, are not spreading the disease, and all they want is some direction to the homes to allow them to spend more time than half an hour every week or two. And just the same people going in, and preferably in their rooms where they're not causing so much work for the staff. But they need more clear direction to the operators to be consistent, because about 20% of people are happy with the visits they're getting. It's the other 80% that don't seem to be opening up.
We've provided clear direction, and I know all of the care homes and the care providers are working to make sure they are following those directions.
Marcella Bernardo, News 1130.
Hi there, Dr. Henry and Minister Dix. I just wanted to ask you how concerned you are about parents now planning to protest current safety protocols in BC schools by keeping their kids at home tomorrow as a day to say that, you know, safety protocols just aren't strong enough for them.
Oh, I hadn't heard that. You know, these are absolutely things that are done on a local basis. The teachers have been involved, the school communities, and so I think the parent voices are very important to ensure that what's happening in their school community meets the needs of parents and children. But you just want to reflect on this. We've had very little transmission in schools. We've had many exposure events, but they have very rarely resulted in transmission, particularly from children to anyone. So this is an important time for all of us to reset, learn from what we have been through in the last few months, to make sure those communication is ongoing and make sure that parents are involved in those discussions as well.
Do you have a follow-up, Marcella?
Yes, just regarding the outbreaks that have led to so many people dying over the weekend, can you please explain what is specifically being done to contain outbreaks at places like Burnaby Hospital and Tabor Village Seniors Home in Abbotsford?
Yeah, there are a number of homes. I have a list of them here where we've had quite extensive transmission within those homes. There are teams that we have in place, and in those in particular, Vancouver Coastal and Fraser Health, they have teams with infection control practitioners with additional both operational support and staff support to try and get ahead of the virus. There's testing that's done on a routine basis of all of the residents and staff in those homes. So we do have very detailed outbreak protocols. It just shows us how challenging it is. This time of year is part of it. It spreads much more quickly this time of year, and it can spread so rapidly in care homes that it's very challenging to deal with these outbreaks. We've had a lot earlier on in the fall where it was a single healthcare worker that was noted, or a single resident, and we were able to manage it very quickly. But once it starts spreading within the care home, it's very difficult to find people, even with systematic testing, which is done routinely of all residents in the affected area. So it reminds us of, you know, the tragedy and the terrible toll that it's taking on those who are most vulnerable. And I think of this weekend that there was, you know, the oldest person who died from COVID this weekend was 103. And you think what that person has gone through.
Les Lane, Times columnist.
Well, thank you. I'm curious about the correlation between the count of currently in critical care and the fatality count, 46 people dying over 3 days, is the equivalent of 2/3 of the ICU count dying over the weekend. But I'm not sure it's like an exact comparison. And the new ICU count as of today is 75. So are patients deteriorating at that rate so fast that count is actually stable and increasing in the ICU?
No, there's a separation there. So about 8 of the deaths this weekend were people who were in hospital, some of them in ICU. Most of the people who died this weekend were people in long-term care homes. And for the most part, people stay in their care home when they're infected with COVID during these outbreaks. So it doesn't reflect ICU deaths at all.
Do you have a follow-up, Les?
Okay, thanks. Yeah, what's the R factor these days? I don't think you've mentioned it recently, that +1 count or the rate of transmission.
Yeah, I presented that, I guess it was 2 weeks ago, a little over 2 weeks ago, maybe 2.5. So yes, we do watch that, and we're still a little above 1, less than 2 at the moment, but above 1 in most places. It is leveling off, but we need it to get below 1 is an indication that that we're transmitting to, on average, 1 person or less. The challenge with this virus is these are models, and I know there were some of these models were presented on the weekend, so they have a lot of input into them that reflects an average transmission rate. So what it's based on is how many people each case transmits to, and that can be it is averaged out when the way this virus transmits is most people don't transmit to anybody, and some people transmit to a lot of people. So it may not reflect exactly what's happening, and it's one of the things that we're learning about this virus, that some of these measures that we use for other viruses like influenza, where they spread more homogeneously across the population, don't always tell the full picture. So they do give us an understanding of where we are in the trajectory and whether we're going up or down in terms of the transmission rate, but they by themselves are not the whole answer.
Richard Zussman, Global News.
You didn't mention them specifically, but I'm assuming in your opening remarks you were speaking to those churches that decided to open their doors on the weekend. Is it correct to assume that? And if not, what do you say to those faith leaders that first opened their doors and second are now threatening to take the province to court around their rights that they have for religious gatherings?
It was actually the opposite, Richard. I was actually speaking to the vast majority of faith leaders who understand how we're trying to work together to protect each other. And I just wanted to express my appreciation. And we know that there's some high-profile people who are trying to create some consternation around this, but just to reflect that most people are doing the right thing, and most faith leaders have been so strong in supporting their communities to do the right thing and to carry on their mission despite having these challenges that we're dealing with in a global pandemic. So it was really speaking to the vast majority of people that are doing what we need them to do right now, and to support them in continuing to do that, and thank them.
Do you have a follow-up, Richard?
Just to follow up on that, are you concerned around a potential lawsuit moving forward against the orders around that? And also, I know you're aware of the work that a lot of parents and others are doing online through their COVID trackers and things like that. Why are the number of exposures much higher on something like a COVID tracker than what the province is reporting? Is there a gap there in terms of the cases that we're seeing at schools compared to the reality?
Yeah, so in terms of the lawsuit, I laughingly say, you know, that part of my job is being subjected to lawsuits, class action lawsuits, and other things. But you know what? We are putting in the measures that we believe are the best that we can do to protect communities, to protect our health, and protect us from transmission of this virus. And there is a balancing that we do with every measure that comes into play. What are the unintended consequences, whether they're positive or negative? What are the goals that we're trying to achieve? How do we make sure that we're doing the right thing at the minimum amount that we can possibly do? And that's the ethical dilemma that we're in. You know, how do you do just the right amount to try and keep this virus from spreading rapidly and causing so much suffering? And there's no right answer to this. There's no perfect way of doing it. And I will always be accused of doing too much or not enough. So that's our life right now. I do not believe at all that we are affecting people's ability to, under the Charter of Rights and Freedoms, and actually I was quite gratified that Pope Francis said that very thing this weekend. This is about taking those measures to protect people from this virus, and no more so than when we come together as a community indoors right now. That puts people at risk. In terms of the online COVID trackers, I know that those are I have not actually seen any of them, but I can tell you that we are very diligent about posting exposures. There have been challenges, as you know, and yes, there is a social media network where people exchange information that we may not be aware of, so that can be out there ahead of time. It can be out there before notifications are put out there, and also there are exposure events that may happen in school-age people that may not be related to schools. So there are many different reasons why those could be different, but I know that the public health teams are working very diligently with each school to do the best that we can and to learn from every exposure event that happens.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated information about the province's restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and the pandemic supports, visit gov.bca.ca/COVID-19. Last question is from Tina Lovegreen, CBC.
Thank you so much for taking my question. My question is for Minister Dix on a different but related topic regarding health spending. During the pandemic, you have ordered a review of spending within the PHSA. What concerned you and prompted you to do this?
Well, thank you. And the news story, I think there's a news story today from PHSA, is concerning because it really doesn't reflect our approach to the COVID-19 pandemic, which has been hugely to support frontline workers, to express support for the sacrifice, the empathy, and the respect for people, whether they're in healthcare and they're in pharmacies. And we heard about the delivery of immunization today, influenza immunization, grocery stores and distribution, a host of areas who have put themselves at risk to keep us safe and supplied and secure. People in healthcare have done the same. That's why I asked Stephen Brown to look into PHSA's decisions and conduct and to report back to me with findings and recommendations. I don't want to prejudge what Dr. Brown will conclude and recommend to me. But I would say this, that I think that it's important if people are unclear about things that they be clarified. It's important that if things were inappropriate, that they be addressed. It's important that if there's a lack of accountability, that it be strengthened. And those are my priorities in this. Et peut-être je peux anticiper la deuxième question, Tina, et dire en français que l'actualité sur la registre de santé provinciale est importante. Je pense que pour tous ceux, et y compris moi-même, qui admire beaucoup la réponse de ce qui s'est passé durant cette pandémie, un peu partout dans la société. Le courage montré, je pense que c'est important pour nos dirigeants de suivre cela aussi et de montrer, prendre exemple, ce qu'ils veulent démontrer, n'est-ce pas? Donc, j'ai demandé à Stephen Brown, le sous-ministre de la Santé de la Colombie-Britannique, de faire de me donner ses recommandations en considérant des faits. Ces faits ne sont pas préjugés aujourd'hui par moi ou par d'autres, mais s'il y a des choses à changer, on va les changer. Et vous pouvez être sûr de cela.
Tina, do you have a follow-up, Tina?
Yes, please, if I may. Our sources say a spending review that ends by end of day tomorrow isn't long enough. They say a deep dive is much needed. What do you say to them? And if you could also answer in French, that would be greatly appreciated. Thank you.
Une deuxième fois, oui. Well, first, I just say that I asked. I got this information. I'm trying to think, but I think it was last week. I asked Stephen Brown, the Deputy Minister of Health, to review it. In some ways, the information isn't that complex, and so what I wanted to do was see that if there was a response that could be put in place rapidly, that it be put in place. If the recommendation is for, as you suggest, a deep dive, maybe that's would be seen as necessary. But I think people just made an enormous sacrifice during this pandemic everywhere, and that actions which may be consistent with guidelines and everything else may cause concern, and the facts on the face of them obviously cause concern. They do to me, that's for sure. And so that's why I've asked Steve Brown to take a look at it and to give me his recommendations, and I'll see what those are, and then we'll act on those. And if more is required, of course, more will be required. Je veux dire en français que si ce que je veux, c'est d'avoir une réponse rapide et des recommandations de la part de mon sous-ministre, le Dr. Stephen Brown. Il va, je pense, les présenter aujourd'hui à demain. Et puis, on va voir en ce moment ce qu'il faut faire. Mais je pense d'une certaine manière, il faut répondre rapidement aux questions si c'est possible de répondre rapidement, parce qu'on a beaucoup d'affaires actuellement et je pense que s'il y a quelque chose à régler, il faut le régler tout de suite et c'est mon intention de le faire. Thank you very much. Merci beaucoup. We'll see you Wednesday.